Welcome to the morning meeting. Hope everyone's doing well. We really appreciate you being here this dreary Thursday morning. I'm going to go ahead and start with a quick update. It was a really big week at the State House on what's happening with our state budget bill before we pass it over to our guest. We're super excited to have Kimberly Friedman here today with us. But I'll just share briefly that House Bill 96, which is the state's operating budget bill, was passed off the House floor last night and is headed to the Senate. The Senate has already begun their hearings, so they started hearing agencies, including the Department of Children and Youth yesterday and the full Finance Committee. The bill passed the House mostly along party lines. There were 5 Republicans that voted no. Many of them cited during some floor speeches that they were upset about investing public dollars into the Brown Stadium, that $600 million bond package that's been making a lot of headlines lately. So we anticipate hearing more about that issue as the bill moves through the Senate. But a few updates on items that our folks have been tracking. We were happy to see that from the governor's version, there had been initially last week some cuts to the Child Care Choice Voucher Program. The House did put back in $50 million each fiscal year. So that program will now be funded at $100 million each fiscal year. Still 25 million less across the biennium than what Governor DeWine had intended. And across the board, we know that the House had initially cut $300 million in federal child care funding, and technically they only put back in 100 when you compare it with the governor's version. So a bit of a win from last week, but still obviously lots of room for us to continue to grow in the Senate. In addition to that, for folks who are tracking the doula language, the House did remove the $500,000 cap on reimbursements for doulas through Medicaid. They did still maintain the 6 county restriction, but they clarified that the 6 counties they'll choose will be the 6 counties with the highest rates of infant deaths. Our team is tracking what the data source for that will be. It wasn't listed in the amendment, so we'll try to get our hands on what the best data source for that is so we can confirm those counties for everybody. There was also a small restoration of funding for the Dolly Parton Imagination Library. Governor DeWine had boosted it from $8 to $10 million each fiscal year. Most of that was clawed back, but they did put back in about a $500,000 across the biennium back toward the governor's version. And we also wanted to note that the child care cred pilot project that some folks have been tracking, where business, families, and employers' family in the state share the cost of child care, that there was an amendment added to cap that for families making 400% of the federal poverty level or less. The kindergarten readiness assessment was not restored, so we will continue to have that conversation in the Senate. And very, very relevant to our conversation this morning, the increases that we had seen and were so excited about in the home visiting, the Help Me Grow line item, were unfortunately not restored, that $22 million that Governor DeWine had really prioritized. So with that, I will be bringing us now to our guest. I'll just read briefly her bio, and then Kimberly can share some more about herself. But Kimberly Freeman is the Chief Program Officer at Family Connects International and the Center for Child and Family Policy. I'll throw a link in the chat for that momentarily. She came to this work in 2018, but has a deep background in the home visiting space. She's an expert consultant for public stakeholders as they explore the development of early childhood systems at the local and state levels. She monitors relevant federal and state policy, provides guidance on public and private funding options, and explores opportunities to engage with the insurance and managed care industries. Both in her experience as an attorney and as a business development officer for a nonprofit, Kimberly's career has focused on early childhood, and we are so grateful to have her here this morning sharing that experience. Dialing in from North Carolina, I understand, but very, very familiar with the Ohio State House, has spent lots of time here, and she'll give us a little bit more background on home visiting and how these programs compare to one another, and then some updates from her advocacy work. So I'll go ahead and mute so that we can all learn from Kimberly's vast experience. Thanks for joining us.
Thank you, Brittany. And first thing I want to share, I am Ohio born and bred. I grew up in Toledo, Ohio, and attended law school at Ohio State, and spent much of my life in Ohio. My husband and I raised our kids there as well. And I've had a good amount of time in the advocacy space, particularly in relation to maternal child health and home visiting, having spent 10 years working for the Nurse Family Partnership National Service Office, but most of that time from Columbus, Ohio. So I've worked with many advocates and certainly many individuals across the state of Ohio, and just like to put in that connection because I think it's important to talk for just a minute about what Family Connects is. It is something that is very different to the way that we do things in our country, but very common in most of the in most of the Western developed nations or countries, and that is providing a nurse or someone to spend time, whether it's a nurse or a certified nurse midwife, or, to visit with families after they come home from the hospital with their newborn, because that is such a time of transition for families. And this is something that up until I'm going to say 2008, 2009 was operating across the state of Ohio as well, known as Welcome Home. And while that program went away, there are some communities in Ohio that have continued to offer that support to families. The Family Connects model was developed at Duke University and really based on a lot of formative work with communities, meeting with families, asking them what they needed and who they would like to get support from. And after many years of formative research, ultimately, the model was developed where at about 3 weeks postpartum, because that's the time when babies perk up and are crying a little bit more, and often the family who may have come in to visit right after the baby's born have gone back, and families, parents have a lot of questions, a lot of needs, and that's also the time when postpartum depression can first start to emerge. So when the model was developed, it was determined based on the feedback from families that it was a registered nurse that families really wanted to have come spend time with them right after they've given birth to a baby and have brought the baby home. The model was developed and tested through 2 randomized controlled trials and 1 quasi-experimental study, both tested in Durham and also in 4 rural counties in North Carolina. Ultimately, in 2022, Family Connects spun out of the university and moved from being an academic initiative to a home visiting model that's replicated now in 20 different states and 53 communities across the country, and also has been found to meet the evidence of effectiveness to be eligible for the MICV program, the Maternal Infant Early Childhood Home Visiting Program. However, Family Connects is not funded by MICV because in the reauthorization legislation that recently passed, the funding is limited to targeted and intensive models. And so I just want to spend 1 more minute and kind of clarify that Family Connects is very different from the home visiting models that you may know that operate across the state of Ohio and in many other states across the country. While the nurse is spending time with the family in the home, most families just receive a single visit. They might get a couple follow-ups from the nurse, which might be by phone, might be by text, or might be in person, 1 to 2 follow-ups, but most families just get a single visit. And Family Connects is really intended to assess and connect, to hear from the family what their needs and preferences are, for the nurse to do screening for maternal depression, interpersonal violence, and substance use, and to have a conversation with the family to identify other needs that the family may have, and then to make warm handoffs to those connections within the community. So I would think of Family Connects not as a home visiting model, but more as a model for triage and connection. And for most families, and it's a single point in time. The other big difference I just want to point out is this is for everybody. It's for all families. There are no requirements except that you live within whatever the defined catchment is, and you have a newborn, which could be because somebody's given birth, because of adoption, foster care, or kinship care. It's for everybody. Um, I do want to turn to talk a little bit about some of the advocacy that we've been doing, understanding that, well, the state has started the wonderful investment with 11 communities now getting their Family Connects programs up and running. Um, we were really excited to see that the state was interested in bringing this to even more communities and that that additional $22 million would really help to ensure that more families can benefit from having this type of assess and connect. And I do also want to note that those connections can be to other home visiting programs that exist within the community. That's something that Family Connects very often does, which is making sure that for families who are eligible and want long-term intensive home visiting, that they're connected to those programs within their community. So the primary thing that we've been doing over the last couple days is reaching out to all of the members of the Senate Finance Committee. And it's interesting that most of those members have a Family Connects program in their community. They represent most of those 11 communities where Family Connects has gotten up and running. So not only have we reached out to the Senate Finance Chair because that office was particularly helpful back in May when we were waiting for the controlling board to approve the funding for the initial launch of Family Connects in Ohio, but we've reached out to Senator Manchester, who has Dark and Shelby counties in her district where Family Connects is serving families, Senator Wilkin, who has Fayette, um, Senator Manning, who has Fisher Titus Hospital. So Huron County is in his district. Senator O'Brien, who has Trumbull County in her district. Senator Chavez, who has Noble and Guernsey in his district. And we've reached out to him, Senator Blessing, who has Hamilton County in his district, and Senator Ingram, who also has Hamilton County in his district. So we've reached out to all of the senators on the Senate Finance Committee, but I did want to particularly note that those members have Family Connects programs operating in their districts. The other thing that we offered to do was write a letter to the editor for Fisher Titus that they could submit talking about the investment that they've made in their community. I'm not sure yet whether or not they're going to submit that, but we have offered and sent a draft for them. We have gotten some comments back that some of the senators that we've reached out to are taking a look and they'll circle back with me. So that's where we've started at this point. And I'll hand it back to you, Brittany. I could talk a long time about Family
Yeah.
Connect, but I know this is a short call.
No, this is fantastic. I have two questions right off the bat while folks are thinking of theirs. One is, do you see through Family Connects, is it primarily first time parents or is it is that not an indicator of what you're seeing for folks who are taking up the program and participating?
It's really all parents.
Yeah.
What we tend to hear a lot of is um, the first baby and the second baby or subsequent babies. Each baby's different, and and our incoming CEO talks about that. She was a baby whisperer. She could quiet anybody's baby, and then when she had her second baby, she was no longer a baby whisperer. Baby number two cried a lot and she really
Hmm.
needed a lot of help. And she got in Colorado. Her hospital, when you had a baby there, they sent a nurse out it was 3 days later, but she really benefited from getting that help and ideas on how to just soothe her second baby.
And the second question I had is what would be most helpful for folks on this call to do right now as we are pivoting and looking toward the Senate? So exciting to hear that the map of the current communities overlaps so much with the Senate Finance Committee members. That's such great news that they're able to see in real time in their districts the benefits of this program. Um, is it finding client testimonials? Is it reaching out via email? What would be most helpful as you're advocating in this space? How could our folks support you?
I'm happy to not only share with you, Brittany, and then if you want to put it out to Groundwork members, our one pager that our senior policy director, who I know is on this call as well, Jordan Wildermuth, put together, but we can put together a couple talking points as well. And I would say anyone who wanted to follow up with Senate finance members or with the members who represent for the districts that they live in to weigh in and encourage the support. And I think of it as it's not advocating for. I mean, obviously, it is advocating, so I won't for a particular program, but it's to help build out a system and a support and a web of connections for families. Part of what we do in the Family Connects model is we have a role called a community alignment specialist, and that is actually sitting with your central intake hub, Bright Beginnings, that already exists in Ohio. So Family Connects isn't adding something new, it's building on and reinforcing what's already existing. And all of the programs that all of your members represent are part of what's referred to and that families are connected to.
And I think legislators like to hear that too, right? Like building on existing programming. And I think that the fact that the Senate Finance Committee overlaps so well with the existing counties is great. But for folks who don't have Family Connects in their counties, they can point to why they want this, and they can share with their legislators, don't you want your constituents to have access to these things? So I think that there's a really strong argument to be made, regardless of what county you're calling in from. Do folks on the call have questions for Kimberly around Family Connects or home visiting? Her depth of knowledge in this space is so deep. Feel free to unmute and hop on, or feel free to type things in the chat, and we're happy to go either way, depending on what folks are comfortable with.
And I saw a couple shout outs from Toledo, so thank you.
I have a question. This is Deborah Held. I'm with Whitehall Kids Academy and All-Star Academy. So we have 4 centers. Question, I would like to get this information out to our parents, and we are going to be having a parent meeting in April. So is there something outside of the websites? Because I see that in the chat. Is there something that is like a flyer that we can get out to the parents as well? Is there something like that? Because I didn't see that on the website.
I'm going to follow up with Brittany and send a couple resources that can then be sent out or made available to Groundwork members. So I hear you, and I will follow up with that. And thank you so much.
That would be great because we do have a lot of mothers, new mothers, 6 of them actually. So that would be fantastic.
Great
Great.
question, Deborah. And we will include all the links in our Friday newsletter. We always do the recap with the recording from this call and all of the relevant links. So we'll make sure that's in there, as well as the invitation for next week's speaker. We try to put it in 2 places so it's easy to find. Do other folks have questions for Kimberly?
I have a question if nobody else does. Kimberly, can you speak? I love to hear this was developed, lots of research, very evidence-based. Can you speak a little bit, or do you have data around like the return on investment, or when you're going into communities as you're doing these initial efficacy studies on the impact it had on like infant mortality or um, other spaces that it supports?
Sure, I can speak to some of the key outcomes. One of the outcomes that the Senate Finance Chair particularly liked when we were talking back in May was increased father engagement in the home. But other outcomes, we've seen significant reductions in postpartum depression and anxiety. I think that early screening and connection to resources can really make a difference. Reductions in CPS investigations, uh, uh, decrease in 50% reduction in infant emergency room visits and hospital overnights. And that's the place where during the randomized control trials, they looked at cost savings and saw a return on investment of $3 for every dollar that was invested in the program. Increase in postpartum visit completion. According to the March of Dimes, about 40% of women do not have that 6-week follow-up visit after they've given birth. And we saw increases in postpartum visit completion, obviously increases in community engagement because of those connections that are made. So greater connection and utilization of resources within the community. Those are some of the key outcomes that come from the research trials. We haven't looked at infant mortality simply because there weren't the studies, while they were pretty sizable, they were not large enough because thankfully infant mortality is still you need a large pool in order to be able to look at it. It is a thankfully somewhat rare occurrence. So my hope is that we're doing statewide rollouts in Oregon and New Jersey, and also a scale up in the city of Chicago. And my hope is that with those large footprints, it will allow for research not only into infant mortality, but also maternal mortality as well.
Thank you, Kimberly. And we did get another question in the chat from Alicia Coleman. Does private funding enter into your conversations with legislators? And this is something that comes up a lot in my legislative meetings, definitely, not specific to this program, but just across the board around leveraging public dollars with private funding to make the program robust. Has that come up for you?
That is a great question. And the state of Oregon has done something, I think it is amazing. And New Jersey has followed. And that is when they pass legislation for statewide rollout, they require any commercial insurer that is regulated by the state to cover the cost of the visit. And they use in Oregon a rate setting process. This is going to blow your mind. The reimbursement from the commercial insurers is $1,800 per family. That is, they are rolling in everything, everything that goes into the infrastructure and everything else. Their Medicaid reimbursement is also pretty amazing. I think it's about $1,200 per family. And then there's additional Medicaid reimbursement. If there are multiples, you add another, I think, $400 to the reimbursement. So yes, that is, I think the idea of having commercial insurance reimbursed for those members that have it, where it's regulated by the state, is a really innovative way of thinking about things. It doesn't include self-funded plans. The state can't mandate the coverage for self-funded plans. And we also don't include the high deductible plans because we don't want anyone paying. Family Connects nobody should pay out of pocket for that.
That is an excellent, gosh, those reimbursement rates are incredible.
Yeah, I know.
And then Alicia had a follow-up, and we've got another question from PJ too in the chat I'll get to, but regarding some more of the private investments, are there any philanthropic investments that the state is leveraging at this point that we can point to say it's not just the state putting in dollars, but these foundations or grant makers are also, or maybe that's an area we can grow?
I think that's an area to grow. There are some communities in the city of Chicago. Philanthropy has helped support the startup. We have a program in Arkansas that is 100% funded by philanthropy, which is unusual. We do have some communities, not in Ohio, but other places where we've locally partnered with hospitals that have made
Mm.
some staffing in kind, and or the hospital foundation has helped, either the hospital foundation or through community benefit dollars. There's been some support for the overall effort. Certainly, having a mix of funding is always very attractive.
Absolutely, to everybody involved, right? Like the philanthropy loves to see the public. It builds on one another. Um, PJ here in Franklin County asks, thinking about kind of whole child, young child experience, are there communities that you've seen, Kimberly, where they're using this program model? They're using this kind of, I know I liked how you phrased it earlier, that it's not home visiting necessarily, but it's more of a triage and a warm handoff connection to services. And somebody might end up in a longer term home visiting
Mhm.
relationship, but this is to take care of those immediate services. Are there any communities that are doing this well and also having any type of a universal early learning, universal preschool campaign to then continue that deep investment in the young child and really set them up for success that come to mind for you? And that might be beyond your space, so it's okay. We could do some digging on this too.
Yeah, I mean, what I would say is there are some communities in Guilford County, North Carolina, and Tulsa, Oklahoma. Family Connects is part of a larger place-based initiative to really um, the name of the program in Guilford County is Ready for School, Ready for Life. And it really starts with prenatal navigation, and family navigation continues all the way up, I believe, if families want it, through child age 8. And there's a whole network of programs that are part of this larger initiative to ensure that children are entering school ready to learn. So I think looking at those place-based initiatives, yeah, Ready, absolutely. It's a wonderful organization and really vision. I think that's something that we can dream about building, and maybe in some of your communities you're already doing that and building those kind of intentional programs.
Thank you. And I know PJ's been traveling the country trying to figure out the best way to crack this nut. So thanks for joining this morning, PJ. Well, Kimberly, we're running out of time, but I am so grateful to you for sharing your wisdom this morning, for advocating so strongly. Would love to send out the resources that you referenced in our follow-up. And I'll just note for our folks that the upcoming timeline, the legislature is going to be on spring break next week and the following. So keep an eye out if you follow your members on social media. They might be doing like coffee with constituents or doing some meetups in the district. That's a great opportunity for you to try to see them. That doesn't involve you traveling to Columbus if you're not based around here. So definitely keep your eye out for that. And then we anticipate seeing the Department of Children and Youth come back and testify in the standing committees, either the last week of April, April 28th, or the first week of May, the week of May 5th. Public testimony is anticipated the week of May 26th in the Senate. So keep that window in mind if you're thinking about submitting Senate testimony. But now is not too soon to start doing that outreach to those Senate committee members and pushing support for this program and all the other wonderful investments that are currently under consideration for young children. So if folks have questions, feel free to reach out. Kimberly, thank you so much for your work. This was a really, if you saw me typing, it was because I was taking notes because this was such a great discussion. It was not because I was
Oh, no.
multitasking. So thank you so much. We really appreciate it and look forward to continuing to advocate with you.
Thank you for inviting me. I really enjoyed this.
Have a great morning, everyone.
Bye-bye.
Bye.